Don't be increasing your expectation. Maybe you should be moderating your expectation. Age naturally will cause erection to be on the decline. Poorly managed medical conditions. See, many medical conditions can cause it. I just mentioned few. Harmful behavioral practice, from cigarettes to ice, to cocaine, to all those drugs, they can damage your erectile capacity. Injuries, from the brain, spinal cord, to the penis itself, to the bone, pelvic bone around the penis, they can damage nerve, they can damage blood vessels. Then psychosocial stress. I just tried to summarize that classification. So next slide. Questions will bring out other things. Now, if you want to, these are the two things we usually use. These are the ways we differentiate them. The one that is psychogenic usually occurs suddenly. The one that happens from a disease usually builds over time. Imagine a diabetic carrying blood sugar of 25 for the next 2 years. Is there damaging blood vessels, damaging nerves? Slowly he will notice that his erection is on the decline until finally it goes up. But psychological are usually a man that performed excellently yesterday. Today he could allow the thing stand. It has been defeated. But maybe it will rise tomorrow. Obviously it will rise once the problems are solved. So they are usually complete and immediate loss when it's increasing. It means for the disease process, if you don't catch it on time, we'll be in trouble. Usually reversal is a tough thing. For psychological, usually they are situational. Situation. You are preparing another woman just say, what is it, sir? Every time is this thing food, everything will just drop. And that's closed. The door is closed. Psychological issues. Now, when it is psychological, our big marker, and that's why I'm repeating it regularly, is that early morning erection. If you still have early morning erection and it's effective, your problem is not going to erase early morning erection. Next slide. Next slide. I finish. Next slide. So we can offer you drugs. We can offer you non-drug measures. I have found out that number one is very effective. Number one is very, very effective. You use not everything that is drug. People are in a hurry, write drug for me. Sometimes when you just listen to their issues, situation, and you adjust one or two things, then they are back. Because majority, a lot of them are psychological problems. But when that has failed, we have drugs that we can give. Up to the point of surgery. But this is not the point where we want to discuss that. Next slide. Follow me. Next slide. Another problem which is common is premature ejaculation, meaning that a man, we call that period intravaginal ejaculatory latent time. The period a man should spend when he has penetrative sex with his wife. So once a man penetrates the woman, if he cannot stay up to 180 seconds, equivalent to 3 minutes, to us we define it as premature ejaculation. But this can happen from time to time, isn't it? That's number 3, variable. A man traveled for 1 year, he came back. The first one he will do cannot even last maybe 10 seconds because he has practiced make perfect. He has been distant for a while. Then before he recovers, and then so that does not mean he has premature ejaculation. It's just a variable. Then you know some people will come to you and say, I am in problem, this. Then you ask them, you say, well, before I used to do 15 minutes. Now it's only 10 minutes. And then I'm like, is that a problem? So it's subjective. To him, that reduction is significant, but for me, medically it's not a problem. So that's his personal assessment of himself. Next. Logical, then organic. Anxiety. Performance anxiety, nervousness. Honeymoon night. Some people don't even do anything that night because they are not able to achieve anything. Because you need to build with time.